What would you say if you knew that 1 in 5 women in the Houston area do not have any kind of health insurance? What would you say if you knew that 4 in 10 women in the Houston area have absolutely no kind of support, social, cultural, any kind of community to turn to? What if you were one of those women? That's what Linda Rhodes, the executive director of the Women's Fund for Health and Resiliency, is here to talk to us about. Her organization has helped women and young girls for years learn more about their health, learn more about how to cope with life, and it is a resource that you're going to want to know about. And we so appreciate your feedback. And remember to subscribe. Your subscription means that we can tell more people about our podcast. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. So, Linda, tell us a little bit about yourself, like where you come from and education and the jobs you've had.
Well, I'm a native Houstonian. My parents moved here from Dabena in Schulenburg, Texas in 1957.
Oh.
Yes, a long time ago. So I'm native to Houston. I went to San Jacinto College. I went to Deer Park High School. I still live in Deer Park. I can't get away from there. I love my hometown. I have 2 children, sons, Randy and Jeffrey. We're both very close. We're all very close. We live within miles of each other. So I just can't get away from Deer Park. I'm raising my granddaughter. Uh-huh. She's 15, going on 35. And it is a complete shift from raising boys.
Oh, yes. Absolutely.
Oh, yes. Raising girls is so much different than raising boys.
But now your whole work life is about girls.
It is. And I started as a bookseller.
I saw that, and I saw how you you even led something very important a few years ago that had to do with booksellers and authors, writers.
Right. I started as a volunteer. I ran a children's-only bookstore and toy store. I actually taught cooking lessons to 5-year-olds.
Oh.
Yes, I did storytelling. I did a variety of things. But I was president of the Houston Area Booksellers Association back when there were independent booksellers, or an array of them. Mm-hmm. And as president, it was my responsibility to serve on the book and author committee, book and author dinner committee with the Houston Chronicle and the Houston Public Library. And I met a delightful woman during that time. Her name was Susan Bischoff. She was one of the first managing editors or assistant managing female. Yes, exactly.
Yes.
And we were in Washington, D.C., and she said, "You're so good at this volunteering and raising funds, you should become a professional." I said, "Well, how would I do that?" She goes, "Well, I know of a job." And she was on the board of the March Dimes, and she said, "You need to apply for this job." And it was for Walk America, which is now March for Babies, their largest fundraising event at that time. Right. And it was breakfast and walking for 20,000 people. It's like,
oh, you jumped from volunteer to running the whole show.
At one point in my career, I knew exactly how many porta potties you needed to have. Something I never, ever thought I would ever need to know. And during my tenure at the Houston area, in the Houston March Dimes office, we grew our revenues from like $2 million to $5 million.
Wow. And
we increased our number of participants from 20,000 to 40,000. So,
oh my goodness, Linda.
Yes.
That's huge.
So I worked in our national office for a bit, and then I finished my career at March Dimes at the state office, working with 18 different division offices, coordinating their walks. And, being in the not-for-profit sector, you have to be passionate about what you do. And
Right.
so I was passionate about moms and babies. My mother had a baby that didn't survive in 1960. It was born preterm. And so it was a passion mission for me. So I've always been in my career in the not-for-profit sector, I've always been involved in voluntary health organizations. I worked for March Dimes for 13 years, and then I went on to American Heart for 3 years, and I did some consulting, and that's how I landed at the Women's Fund.
What attracted you to the Women's Fund for health and resiliency, right?
Exactly. It was a challenge at the time that I took the job. We were serving about 1,500 women and girls annually. And I noticed that the revenues were going down on a regular basis. And it was, they had a good mission. I knew they had a good mission. I didn't, I had been a consultant for them. So I understood the fundraising aspects of it. And I was like, this is what I can do. I can turn this around and change it. Now, what I'm not is I am not a program person. I don't have that background in public health, but I've surrounded myself with really, really intelligent and bright people who are. And my board challenged me at the time to drive more participants to the Women's Fund. And my philosophy in fundraising has always been, if you have more mission output, you're going to raise more money. Fundraising is storytelling. And we had a good story to tell. We had solid programs that were written by incredible people with fascinating backgrounds. And everything we do is evidence-based and based on the science. So we have curriculum-based classes. We have one-time classes. We do them for both girls and women. And so I've immersed myself, and I know enough about our programs that my staff tells me, you've said enough, well, let us do the rest.
You're right. But now, what exactly does the Women's Fund do?
The Women's Fund provides free health education classes to women and girls. We also publish 4 publications each year in both Spanish and English, and we provide all of our services free. We have 3 different curriculum-based classes right now we're about to implement. We're in the piloting phase of a new one for women that'll be starting this fall. We have our What About Me classes, which teach young girls resiliency skills in part 1. So we talk to them about positive thinking, decision-making, goal setting, all the things that are so important and critical to being resilient. And then we show them in part 2 how to apply them to their everyday basic health needs.
What are the ages of these girls?
We start at 9 and above.
Okay.
So our classes are suitable for 4th grade and above. Typically, where we'd see most of our classes falling in our What About Me, because it's a 10-session curriculum. It actually goes, and there are 10 consecutive weeks with the same 10 to 15 young ladies. So we're building community with them and giving them a safe place to speak and ask questions and learn about their health and about all these important topics that we assume we're talking about at home, but we know that we're not. No, we're not. And so what we're finding is it's typically 5th grade through middle school that go through our What About Me classes.
Now, is this during school year?
It's during the school year.
Really?
It can be during the school day. It can be before school. It can be after school. We do some programming with other organizations where it might be an after-school program. And so they allocate one period of the day, and we can go in through the life skills class. We can go in through PE. It's really, the girls are typically selected by a counselor or a teacher that sees that they may need a little extra something. And we do pre and post evaluations on them. And while it's not our program where we see the most young ladies, it is the most impactful because we're seeing them for 10 consecutive weeks.
Right. So, Linda, do you think there is I know there's a difference, but What do you think is the major difference between when you were a young girl and when I was a young girl with our young communities now?
Social media,
Okay.
where they get their information. I think the family dynamic has changed. I was lucky enough or fortunate enough to go to a luncheon that University of Houston Graduate School of Social Work had several years ago. I mean, it's probably been 7 or 8 years ago, and I got to hear Dr. Perry, who's a trauma specialist, talk about it. And one of the things that really stuck with me, and this is so resonates with me because I come from, while I only have one brother, I have 25 first cousins.
Whoa.
And we're, yes, on one side. So he said the difference today from our generation is that where your immediate family, that family unit was 20 to 40 people, like my family. Mm-hmm. Now the average child has a family of maybe 3.
Oh,
yeah,
kind of.
because we're so disconnected. And when I look at my dynamic with my granddaughter, she has maybe 3 or 4 cousins. I had 25 on one side, and I'm still connected to most of them. Mm-hmm. We communicate via text, and we talk, and we take trips together. But, I think that is a big change. And then you pull in social media and misinformation and where they're getting their data.
Do you think they're more frightened than girls of the past?
I don't know that they're frightened. I think they're experiencing more. I can't really say if they're experiencing it more or we're talking about it more when you think about the violence in homes, the sexual abuse, things like that. I think we've become more vocal about it.
So when you started, it was 1,500 girls?
Yes.
And now it is?
Well, right now, last year we served 9,600 women and girls.
Oh, my goodness.
In 2019, we were serving 12,000, so we're still working our way back up to our pre-pandemic numbers.
But during the pandemic, you made a real shift that actually has turned out very, very good for the organization.
Exactly. We went to a virtual format where we were presenting our programs virtually on a regular basis. I think the big shift there was we didn't really know who our audience was, and we didn't have that one-on-one contact, and we know for a fact we were not reaching the adolescent girls because a lot of our programming takes place in the schools. Mm-hmm. And so if you remember during the pandemic, the schools were having challenges because the communities we serve are at risk or underserved. Well, everyone assumes that you have internet. Well, sometimes the only internet you have is at the library or at school. You may not have that access at home. You may not have a laptop. You may not have that. And that was one of the big challenges for the school districts also, especially in those communities where primarily we serve.
And those communities are which ones?
Well, we serve a lot of the 5th Ward, 3rd Ward, Sunnyside, even Sharpstown, a lot of different areas. We, on an annual basis, we're probably in 25 to 50 different zip codes each year.
Goodness. So
we're all over the city.
Yeah, you are. So the Rose relied on the Women's Fund. Of course, back then it was called the Women's Fund for Health and Research. Health Education and Research?
Education and Research.
But I can remember when y'all were the only ones that provided free literature. Mm-hmm. And that was all we had. I mean, we didn't have the funds to go and print things up. And it was so important because you had what I call diaries or journals that young women could use. But now that has grown tenfold or 100-fold.
Right.
And you have all of these different education pieces, which are really good. I mean, I was going through one of them for the young girls, and it covers everything, and it's very, what do you say? It's like this happens, and this is what you need to be prepared for, and this is how you handle it. And I thought, even any young girl could benefit from that, from being able to just read that things like this, things that are not expected, things that you've heard about can happen, and here's how you handle it.
Right. Our publications and our classes focus on a variety of things. We don't just talk about the basic health needs. We talk about your emotional wellness, your mental health, and one of our newest programs is called What About My Mind, which explains the mind, how your brain works, and goes into stress and coping. Instead of trying to cover a lot of different things in a 45-minute session, we've broken it into 6 sessions. So we talk about eating disorders, a lot of different mental anxiety. There's just so much that's going on that we have, after the pandemic, we wrote this during the pandemic, but immediately following the pandemic, we realized, and we were getting calls about mental health sessions, because we do another program for girls called Power Up the Heat. HEAT stands for Health Education Anytime. And we created that program in 2016 to address the issues for schools that couldn't allocate 10 consecutive weeks. So it covers a lot of the topics, or it can cover the topics that we have in our 10-week session, but we also find that they ask for trending topics. So trending topics could be bullying, could be relational aggression, could be personal hygiene. We assume that our mothers are going to tell us.
My mother didn't. Did yours?
No, my mother still hasn't told me about sex, and I'm 66 years old.
I know.
And so I've got 2 kids. Surprise, surprise. But,
But still, that was just not talked about.
It just wasn't talked about. Personal hygiene, there's just so many things and that they don't talk about. And we teach girls to find a trusted adult that you can confide in, whether it's a teacher, a counselor, an aunt, whoever that is. And, that's one of the things that my granddaughter and I talk about is she tells me I'm her trusted adult.
Oh.
Yeah, but do you really trust me and tell me everything?
Right.
Yes.
Right.
So, but some of the barriers is cultural, and those taboos. It could be religious, why we don't talk about things. But there's just so much that isn't talked about.
So true. When did y'all decide to change the name to include resiliency?
We actually changed the name in 2015. However, we funded 58 or more. I'm trying to think. Numbers have evaded me, but we funded more than $1.4 million in research. We started as an organization that did research grants for women, for investigators or researchers who were doing work in the women's arena, menopause, a variety of different topics. And in about 2004, the board started talking about, are we making the impact we want to? Because by 2008, you think about all the different organizations like American Heart, who was doing so much research into women's and heart disease. Was our $5,000, $10,000 really making the impact we wanted to? So we made the switch and went into a public health model. And that's when we started our What About Me classes, and they've evolved into a class that looks like What About Me for women. It's 10 weeks. It's called the Women's Health Advocacy Program. We offer smart lunches for women, a variety of different topics. And we went into the public health model, presenting programming. And then we really started promoting our publications. We still do our House My Health, which is the health journal you were talking about. So we changed, and we just caught up and changed the name to the Women's Fund for Health Education and Resiliency in 2015. That's when the board, we are very slow, not as a board, but we very thoughtful and thought-provoking before we make big
I like
changes.
That. Nonprofits, though, are historically thoughtful.
Yes.
I mean, it takes a while.
Yes, it does.
Yes.
So I think we talked about it for 2 years. Mm-hmm. So
what's been the biggest challenge since you've been there? Leaving 2020 aside.
Oh, that was a challenge. Right now, I would say the education system. Of those 9,000, almost 10,000 women and girls we see about 53% of our classes are for young ladies, young girls. And the barriers we're facing right now is getting into the school districts. It's become harder and harder to jump through that barrier and get in there. So, whether it's from the fact that they're testing all the time, or now the barriers with the HISD. Mm-hmm. We have to have special credentials, and you have to be a certified this, or you have to. But there's budget cuts. They don't have the resources within the school districts. I mean,
because you have to have partnership.
We have to have partnership,
and if they don't have the resources to provide,
exactly,
then, yes,
even So, for example, with HISD, they let go the majority of their wraparound specialists. Well, we partnered very closely with their wraparound specialists, and that wraparound specialists were the individuals at each school who were to bring in additional resources that kids need. So right now they're so focused on learning, you think about the children that are left behind. I think one of the things about our classes that are so important and vital is those 10 weeks we work with the same facilitator that can be a volunteer or one of our staff people. It's the same 10 to 15 girls. They build this community. Mm-hmm. And if you know much about resiliency, one of the things about being resilient is being connected.
Right, absolutely, yes.
Is the connectivity. And we have a question box at the end of each session, and each girl is required to fill out or turn in an index card. They may or may not have a question. There's time during the class for questions and answers, but sometimes girls aren't comfortable asking those questions out loud. So every session or every semester, there's at least one instance where we identify a girl who's turning a question, how do I know if I'm being sexually abused? My father hits me or something like that. And so, did they tell anybody else? Mm-hmm. One of the other barriers in schools today, I believe, is the fact that not every school has a school counselor. No. Or a school counselor for 300 or 400 kids, and how do they get the care that they need?
Right. Those are definitely challenges.
There are challenges.
Can an individual cover the cost of a 10-week program?
They can. They can.
So that's one way someone could
get involved. They can volunteer. They can come in and volunteer if you have time. It's a big commitment to teach a What About Me class. You don't have to be any kind of special training. You just have to be willing to commit an hour to 2 hours every week for 10 weeks. We do a train the trainer model where we teach you everything you need to know. You don't and the good thing about our classes is you don't answer the questions that day. We go back, and if you're not comfortable, everything we do is evidence-based. So we encourage facilitators not to answer difficult questions, to go back and do the research, because it's not about my opinion or your opinion or their opinion. It's about what does the science say.
What does the science, right?
What does the science say? Because we can all find out everything we need to know from Dr. Google.
Yes, we can.
Yes, we can. And how often is it accurate?
Yes.
Yes.
Absolutely. So you recently had a seminar that really covered some, I didn't get to go, but I received your information afterwards, really covered some very interesting stats about girls and what's going on. And I just thought, what was the one thing in that seminar that really surprised you, you felt strongly about, you wanted to get it out?
Well, I don't know that there were any big surprises for me.
Well, but you're in it all the time.
I'm in it all
Right.
the time. I think it's alarming that Texas ranks in the bottom quarter in almost every category.
Every category.
Every category on health and wellness. I think it's alarming that we have such a large amount of women dying from,
Maternal health
maternal
issues.
health. Yes. But having been with March Dimes, and we've actually done a doc talk on that, on the maternal mortality rate. But the fact that, and that was in 2018.
Right.
And it's not any better today. I remember when I worked for March Dimes, 1 in 7 babies were born preterm, or the infant mortality rate was 7 in 100. And things haven't improved.
But one of the underlying issues in that, if I'm remembering right, was again that connection to community.
Community,
that,
exactly.
Yes, you didn't have someone to talk to or to find out or to turn to during that time.
Right. And think about when you've had a baby. You, for 9 months or however long, you find out when you're 6 weeks along. You're seeing your doctor on a regular basis. Okay? You're seeing him once a month, every 2 weeks, at one point once a week. You have that baby. You go home. You don't see him again for 6 weeks. And then after that, you're fine.
Right.
And so there's so many determinants that, play a role in that.
And so many body changes.
Body changes.
Oh,
It
yes.
took you 9 months for your hormones to get this way.
Right.
And then in 6 weeks, you're supposed to be, boom, you're okay. And I think the alarming part of the maternal mortality rate is that Black women are more at risk. I think it was 41%.
Yes.
It was alarming.
Alarming.
But it wasn't surprising.
Now that's kind of scary.
Yeah,
Alarming, but not surprising.
Not
And
surprising.
I understand, even in breast cancer, it is our Black community that is more at risk.
Yes.
It just keeps, it's like every aspect of life. There's another issue they're dealing with that perhaps the white woman isn't, or, so it's
Heart disease.
Yeah,
every
area.
And I think that then this is my opinion. I feel like it is, they're not listened to.
Well, that's
But then,
a dilemma of women to begin with.
exactly.
Yes,
Exactly.
and when you don't have that resilience, when you don't have that personal permission to talk or to speak up, I think that's what the Women's Fund really does. We can talk a lot about
Exactly.
programs, but it's giving that young girl the ability to speak up and to say, this isn't right for me.
Young girl, women.
Women, yes.
Yeah. I remember arguing with my OBGYN when I had my hysterectomy. He goes, well, we're going to take your ovaries. I said, no, you're not. And he asked me, why are you so worried about this? I said, because if they don't need to go, they don't need to go.
Right.
I said, and so we went back and forth. He goes, you are obstinate. I said, no, I'm not. I'm an advocate. I'm
For
an advocate.
yourself.
I'm an advocate for myself. I know what I want. And I think that that's the most important thing we can teach our young ladies, our young girls, and our peers, is you can be an advocate. You don't have to you need to speak up.
Yes, yes. And who has more influence on us than a friend?
Exactly.
Really and truly
Yes.
when you get down to it. Yeah.
Yes. You've got to speak up when you're in the doctor's office.
And you've got to speak up when you know something isn't right.
Exactly.
And I will tell you, that's so hard sometimes.
It is.
It's easier not to say anything, ignore the situation. And no, I absolutely agree with you.
And it took me a long time to get there.
Well, it took us all. And thank goodness the Women's Fund is giving so many women and girls that chance to at least know about it. I don't think I even knew I could do that until I had to.
I know.
Yeah.
I know.
All right. I want you to take just a few minutes to tell us, how can someone be a member, a volunteer? What do they have to do?
Well, membership is basically a donation to the Women's Fund, but you do get invited to some fun events.
Yes.
And get
monthly events, right?
We do
Almost?
Quarterly events.
Quarterly,
Well, we do programmatic events,
right?
Which are always free, which you can come to, and you'll get invitations to. But we also do member events. We do four luncheons a year at Tony's. Mm-hmm. We have one coming. We just had one in September on healthy vision with Dr. Morgan Jones. We'll be having another one in December. We do them February, May, September, and December. And who doesn't love lunch at Tony's?
Oh, yes. That's a treat.
But one of the things that when I came on board is I made sure of is every function we have, there's a good for you message.
What is that?
It's something about your health.
Oh.
And so at our luncheons, at our membership luncheons, we have a 20, 30-minute talk by a doctor, or could be a therapist, it could be something inspirational, but we bring in a guest speaker. At our Rock and Resiliency Luncheon, we have an inspirational keynote speaker who'll come in and talk about being advocating for yourself, or resiliency, whatever it may be. We do an education session at our Rock and Resiliency Luncheon. And this year we had young ladies that are high schoolers that have talked about the challenges they have. And they're going to talk about what you and I just talked about, advocating for yourself, knowing that something's going on with your body or your mind, or, something just isn't right, and speaking up and not being I don't want to use the word afraid,
but it is.
It could be fear. What's this doctor going to think about me? What's this therapist going to think if I question what they're saying?
But that's so powerful.
It is
to
powerful.
Hear from the girls who are involved in it.
Exactly.
That's so powerful.
Yes, and it's girls speaking to girls. So I think that's very powerful.
So tell me your website.
thewomensfund.org, www.thewomensfund.org.
That's simple.
It's that simple. You can go online. We have a place where if you want to volunteer, you can go to the tab that says Get Involved. You can fill out the form to say Be Involved, be a volunteer. We do lots on the weekends. We have partnered with the Bayou City Arts Festival. We do health fairs on the weekends. So if you can't volunteer during the week and want an opportunity to come spend a couple hours,
there is something for you.
There's something for you. We have a lot of different things.
Well, I can't imagine anything more powerful, more important than educating and supporting and encouraging, uplifting others, other women, other young girls, than what the Women's Fund is doing.
Well, thank you, Dorothy.
Well, thank you so much for being with us today.
Thank you for having me.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish. It's essential.